Amazing. So thank you for all 53 of you for choosing to spend your weekend with us. I know everyone's in different time zones, so good morning, good evening, everyone. My name is Tori. I'm the founder of Medical Herstory and will be one of your very many co-hosts for today. So thank you so much for tuning into Pregnancy in a Pandemic. We're going to be having a global conversation on the COVID-19 birth experience, and we're very excited to be partnering with Students for Global Health Cambridge. So a little bit more about Medical Herstory. We are an award-winning international nonprofit led entirely by youth, and we're on a mission to eliminate sexism, shame, and stigma from health experiences. We do this by raising awareness on gender health inequity through storytelling, undoing stigma, medical education, and patient advocacy. We hold a range of workshops, run an online publication, and hold awesome events like these. And we also are very active on social media, where you can find us at Medical Herstory on Facebook, Twitter, Instagram, and even TikTok. And you can check out our website, medicalherstory.com, to learn more, donate, submit a story, or if you want to. And we're really excited to be here with our partners, Students for Global Health.
Hi, thanks, Tori. Hi, everyone. Thank you for coming to our event this morning, evening, or afternoon. We're really excited to be collaborating with Medical Herstory today. So I'm Lydia, and I'm the co-chair of the Sexual and Reproductive Health Subcommittee of Students for Global Health Cambridge. Students for Global Health is a UK-wide student network and registered charity that tackles global and local health inequalities through education, advocacy, and community action. Our vision is for a fair and just world in which equity and health is a reality for all. Here in the Sexual and Reproductive Health Subcommittee of the Cambridge branch, we aim to promote sexual and reproductive health and rights, as well as creating positive change in our local community. We run lots of events throughout the year to educate ourselves, other students, and members of the public on a range of topics within this field. At the start of the year, we launched the Cambridge Period Project, a campaign that aims to reduce period poverty within our university and the local growing homeless community here in Cambridge. So please do follow us on social media to keep up with the work that we do.
Before we start our wonderful event, we just like to start with the land acknowledgement. Medical Herstory is based in Montreal or Tiohtià:ke. Many of our events and operations are located on land which has long served as a site of meeting and exchange amongst Indigenous people, including the Gayongehaga of the Haudenosaunee Confederacy, Huron-Wendat, Abenaki, and Anishinabeg nations. Medical Herstory and Students for Global Health Cambridge recognize and respect these groups as the traditional stewards of the lands and waters on which many of us are today. The speakers for today's event originate from the UK, US, and Canada, all countries that have benefited from the historic mistreatment of Indigenous peoples. Against this background, we are dedicated to the continued pursuit of truth and reconciliation. We would also like to issue a content warning. Topics of discussion today may include sexism, trauma, transphobia, medical violence, and other sensitive subjects that relate to pregnancy, giving birth, and the COVID-19 pandemic. Medical Herstory and Students for Global Health recognize the challenges of today's discussion, and we are grateful for the courage of our speakers in sharing these experiences. Please practice self-care and take breaks, log off if you need, and you can always reach out to one of our teams for extra support. And lastly, we'd like to remind everyone of the Zoom etiquette. Please respect everyone during the meeting and on the chat. We ask everyone to please remain muted unless speaking to minimize background disturbances. And please direct any questions, including to speakers, to Salma or Madison via the chat. We also would like everyone to know that this event will be recorded and closed captioning is available. And now we'll proceed to a brief introduction for Rosie Maternity Voices. Lydia, take it away.
Thanks, Shala. I'm very pleased to introduce Caroline Sverchkowska-Dodd, who is the chair of Rosie Maternity Voices, to speak for a few minutes before we meet our panel. Rosie Maternity Voices is an advisory and action forum run by parents, doulas, and birth worker volunteers. They represent the voices of birthing women and people, as well as their partners and families, who use the maternity services at the Rosie Hospital, which is the maternity hospital here in Cambridge. They collect experiences of the care people receive at the Rosie Hospital and feed this back at regular meetings with senior hospital staff, health commissioners, charities, and volunteer groups to improve people's experiences and develop these services. They pledge to listen and take positive action for people at the Rosie Hospital. And we're really excited to have Caroline share some of the experiences of people using maternity services here in Cambridge during the pandemic, and to introduce us to some of the topics we will discuss later with our panelists when they share their personal experiences. So Caroline, please take it away whenever you're ready.
Thank you very much, Lydia. So all through the slides, you will see these are actually pictures of local birthing people and their children. So these are all people who over the last few years have had their baby under the care of the Rosie Hospital here in Cambridge in the UK. And we, as a Maternity and Neonatal Voices Partnership, represent those people, anyone who is under the care of the Rosie. And we have two main jobs to do. If we can pop to the next slide. We focus on co-producing service improvements. So we work with the hospital to make things better. A part of that is telling the hospital when things are going really well as well. And then our other main focus is on gathering service user feedback. So listening to people who are using the services and feeding back their general trends and stories to the hospital. And it's really important that the work we do listens to all voices, even when they're only a whisper. And we try and really keep the focus of the hospital on the service users. And so it's part of that is constructively challenging the work the hospital does. And nowhere has that been more difficult to do, of course, than during a global pandemic. Let's pop onto the next slide. So what's changed for people giving birth over the pandemic? We've had service restrictions, and what I say about the Rosie in Cambridge is fundamentally true for a majority of hospital trusts within the UK, and may well be true in other countries as well, that many services have been restricted. So people's birth partners haven't been able to come to all appointments. They've not been able to have anyone with them as a scan. Antenatal and postnatal wards, where people are before and after they've had a baby, have either had restrictions on people visiting, or for a period in the pandemic, no one able to visit at all. Appointments, some of these have remained face-to-face where that's clinically necessary, but some have been changed to video or phone-based appointments. Birth partners have been limited. So instead of often 2 birth partners, certainly in our hospital and many other hospitals are allowed for that process, we've only had 1 named birth partner to be with someone who's giving birth. And of course, that's been limited again if the birth partner of choice has had COVID symptoms or a positive COVID test. The woman or birthing person has then had to try and find someone else to be with them for that time. Women and birthing people have had reduced in-person support. So both from their immediate family and friends, who you might expect to be coming physically round to the house to help before and after a baby is born, but also reduced access to those wider in-person support groups that are so crucial for the early parenting period. Mental health support needs have increased. And of course, the capacity for giving mental health support within the NHS as a whole has not yet fundamentally increased in line with that mental health need. Staff have had to wear masks, and that affects communication. And some women and birthing people have, of course, had their own COVID-19 related health concerns. So as well as being affected by the pandemic as a general thing, it's affected some people's actual birth experiences. They have had the options that are open to them in terms of where they are able to birth, who they're able to birth with, are restricted due to their own COVID-19 positive status. Thank you. What's been the same? Well, we're really proud at the Rosie that we have retained a home birth service. And I'm just going to tell a very short story about that, because as a change for us as a Maternity and Neonatal Voices Partnership is during the pandemic, the NHS, the National Health Service in England, felt that it was really important that service users were represented when hospitals were making decisions, really difficult decisions about what services they were going to have to restrict to keep everybody, including the staff and the birthing people, safe. So I remember getting a phone call on, it was Good Friday, so a holiday, from the head of midwifery, where she had some really key concerns from staff around the safety of maintaining a home birth service. And because of this new statutory responsibility, she was able to talk to someone like myself representing service users. So it wasn't now just the hospital making a decision from their own evidence base and information base. Now service users actually have a governance responsibility within that, and so we were able to really talk through the needs of the staff and the needs of the service users, and we're able to come to a conclusion where we were able to keep our home birth service open. So we're really proud to be part of that decision to make sure that people had all the places that they could birth available to them throughout the pandemic here in Cambridge. We've been able to maintain the elective caesarean service, which hasn't happened in all hospitals. So people choosing to give birth through a caesarean through either parental choice or because of known medical needs have been able to still have access to that service. We haven't had any ward closures due to the pandemic. And the same level of in-person birth support has been retained. So people giving birth have still had that same level of midwifery care all throughout their birth. And the same care standards have applied. Thank you. Yes, we'll go to the next slide. So something we did was to ask at the height of the restrictions, what was most important to women, birthing people and their partners and their families? What did they want back the most? So that we could support and advise the hospital to prioritise retaining services where it was most important to service users. And at the time, partners could only stay for 2 hours after the birth. And that was absolutely key for the person giving birth, that they felt that having their partner there for a longer duration was the most important thing for them after the birth of their baby. And as a result of this work and work that the hospital did on maintaining and improving safety around the hospital, that's actually now moved to up to 6 hours after the birth, which isn't perfect. It's not what we had before the pandemic, but it's been a positive change that we've been able to make. Things that haven't yet happened that really are key to service users locally are partner support from the start of the induction process. So someone going in for a medical induction for whatever reason at the moment does not have their partner there supporting them until the point at which they are further on into active labour. And of course that can be hours, it can be a few days in a hospital on your own, going through that really difficult, sometimes early labour stage. That's something we're still working on with the hospital. And so there are other things that people really wanted to show that was important to them. So having partners be able to visit the birthing person and the baby on the postnatal ward, having partners attending scans, particularly where it is the other parent of the baby that's coming there and being part of that clinical part of their baby's journey, but also things like finding out how their baby's doing, their baby's health and their baby's gender, if that's something that the parents have chosen to find out. And having that partner support through that appointments, it's always really difficult in any medical appointment to have an appropriate balance of consent and informed consent, and being there on your own is always more tricky than being there with someone else who can help ask questions and probe and make sure that you have all of the information you need. So just before this meeting, I actually went on to our new parents group and I asked a few parents if they could just give a single word that summed up their pandemic experience, and the words that came out were uncertainty, lonely, which came twice, isolated, which came twice, and also fear. And I think you can see from those words that the changes that have happened throughout the pandemic, with restrictions particularly coming and going and being enforced in different ways, have really helped, have not helped parents to feel that they know what's going to happen in their pregnancy journey. And that isolated and alone really comes through in the survey, where parents really just want to be together as a couple or with the people that they've chosen to be part of their birth throughout all of that experience. Thank you. So we ask parents what they think of their care normally, and we've been able to look at the data, particularly from the start of the pandemic restrictions onwards. So pregnancy care was good or excellent for 68% of the people who responded to our survey during the pandemic, but their concerns were around seeing different midwives each time, lots of changed appointments, and particularly partners not being at scans. Care at labour and birth remained really high during the pandemic, so people were generally really happy with the standard of care they had when they were in labour and when they birthed their baby. There were concerns around being listened to or believed, and also about partners again having to leave shortly after the birth. However, postnatal care is where we've seen the most level of concern from service users, and this is borne out in the statistics, with 48% in hospital and 46% in the community in the days and weeks after a birth felt that their care was good or excellent, so less than half. And we have lots of concerns raised with us around lack of support, staff attitude, communication. In the hospital, no partner visiting or very, very short partner visits. And at home, again, those short visits from medical staff, not enough support. Women and birthing people feeling that they are alone at home or in hospital with a new baby and just not getting that family, friends and clinical care that you would expect for them in the first days and weeks of life. Thank you. So the biggest issues that we have found throughout the pandemic here at the Rosie, but I think they hold true across the UK: mental health, partner involvement, support for new parents and communication. And I suspect that in our parent stories today, we're going to hear a lot about some of these themes. Thank you, Lydia.
Thank you so much to Rosie Maternity Voices for your work in advocating on behalf of patients and your insights into the challenges and changes to maternity services during the pandemic. Both Medical Herstory and Students for Global Health Cambridge truly appreciate your work. Of course, I will introduce myself. My name is Nick Bauer. I am part of the medical education team with Medical Herstory, and I am excited to be leading us into our storytelling segment and panel discussion. In selecting our speakers for today, we were intent on facilitating a discussion of pregnancy in a pandemic amongst individuals with a diversity of backgrounds, identities, and lived experiences. In reviewing our panel, consisting of parents, influencers, and birth workers, I am confident that we met this goal, and I'm honored to be part of this conversation today. In terms of the structure for the next hour, I will begin in introducing each of the speakers and inviting them to share their story of pregnancy, birth, and postpartum life, both before and during the COVID-19 pandemic. Following these stories, we will open to a focused panel discussion and finish with a Q&A from the audience. So at any point during these stories, if you have any questions for the speakers, please once again send them to Madison Kurth or Salma Muhammad, and they will relay them to us so that we can ask them. So without further ado, I want to extend a friendly welcome to our panel speakers and begin our storytelling segment. Welcome and thank you everyone for joining us today. First to speak is Andie Hosch. Andie is a transgender father who, supported by his partner Kay, gave birth to their little one Taylor in April of 2020. Andie's story of transitioning, identity, and pregnancy during a pandemic is truly inspiring, but I'll let Andie share his story. So feel free to unmute and please, Andie, share. Thank you.
Thank you. So yeah, my name is Andie. My pronouns are he, him. And I am a trans man who I decided to stop my transition to have a baby with my partner. When we decided that I was gonna stop my transition in order to have a baby, this was months and months before a global pandemic was on the horizon. But it was an interesting time to go off of testosterone after being on it for several years and trying to find the right people to support me. I lost quite a few friends when they found out that I was trying to have a baby. And that was really tough because when you're starting a family, I definitely needed all the support I could get. And the people who decided they would not support me in it, it was a tough period. Thankfully, when I went to get my birth control removed and in order to start trying, I had gone to a Planned Parenthood to get it removed, and I had asked if they knew any good OBGYNs who would know anything about helping a transgender pregnant person. I was like so lost out of it. I didn't even know if it was possible really to give birth after being on testosterone for a while. And because when you start on testosterone, they make you sign this paper that has all the risks of testosterone, and one of the risks is infertility, or so they say. Since that time, I've been able to do a lot of research and connect with a lot of other trans parents who gave birth to their children as well. And we've found out that there are actually no studies that show that testosterone inhibits fertility on its own. And when I asked if they knew anybody, somebody at the worker at the Planned Parenthood, a nurse or something, had just gone to a transgender health conference, and they gave me a name of the person who was my OBGYN, who was just amazing. I think that if I hadn't had this specific OBGYN, I wouldn't even consider having another child, because she just made it so easy and so comfortable for me in a typically uncomfortable and very gendered environment. She, at the beginning, asked me what I would like my reproductive parts referred to as, if I had any preferences to that, and very active in trying to get the fact that every time she put in that I was a male who was pregnant, the system would yell at her. It would like yell, say, this is not an acceptable combination of events. A man can't be 8 weeks pregnant. And that was the first part of the odd series of events. I was 32 weeks pregnant, 34 weeks pregnant when when the United States shut down. And thankfully I work for an amazing company that said, hey, we're gonna pay you out until the state starts paying for your pregnancy leave. They said, go home, you're considered high risk. We want you to be safe. And it was very, very scary, especially since me and my partner both work for the same company. We were really worried about what would happen if the company didn't make it, or if the unemployment was a struggle. And it was like there was a lot of uncertainty, as I know a lot of people felt. But I can remember the first doctor's appointment where my partner Kay had dropped me off, and he was going to go park and then meet me there, and they wouldn't let him inside. And they didn't tell us beforehand that it was that partner support wasn't allowed anymore. And I remember talking to the doctor, and I was like near tears, right? You know, pregnancy hormones plus like fears plus everything. I was just like a mess. And I asked the doctor, I said, is he gonna be able to be there in the delivery room with me? Because I cannot do this alone. And thankfully, the hospital that I birthed at allowed still for there to be one support person throughout the entire process, from being admitted to birthing to after the fact. The only caveat was he couldn't leave, because if he left, he wouldn't be able to come back. But I was so grateful for that, because I had been reading stories of people in New York who had to birth alone, and then they were isolated, and it was just all of the things all at once coming together, not really knowing what was going to happen with the future. Oh my gosh, now there's a pandemic and we're going to have a baby, and just all of that. When we went to the hospital, I ended up having like a 30-hour labor, and they sent us home when I went in the first time, because I wasn't progressing enough. So when we went in for real, I waited a very long time. And at that point I was already like 8 centimeters dilated, and they're like, okay, we're admitting you and let's get you going. My OB had done a pretty good job of like letting all of the nurses know about my pronouns and how I'd like to be referred to. And on my birth plan, I had written that I don't want to be called mama, and I don't, my pronouns are he, him. I am Taylor's father, and those are my limits. And there was only one nurse who couldn't quite get it. She kept calling me, oh, congratulations, mama, congratulations, mama. And thankfully, my partner was there and kept correcting her, because I was like in labor. And it was not as easy to correct someone then as it typically is. And so she ended up excusing herself from my labor because she couldn't get it. It wasn't necessarily malicious. I think it was just something that she's typically used to, and just one of those biases in the medical system. But thankfully, other than that, it was a really, the birth itself was really smooth. My OB made it just in time for me to push, which was really incredible. Her and her husband both work at that same hospital, and they were both on call. So there was some restriction with their child care that she wasn't sure she would be able to make it, but she made it like just in the nick of time, which just made it incredible. And my beautiful baby boy Taylor was born. He gave us a little scare with his umbilical cord wrapped 2 times around his neck. But thankfully my water never broke, so he was like completely okay. And they let us out of the hospital in like within 24 hours, which was crazy. They gave us a less than a day old infant and said, go home. Because of those pandemic restrictions of trying to get people in and out of the hospital as quick as possible. And I'll say that I was actually pretty excited. It was one of the things that was cool is I didn't have to tell people not to come yet because there was a pandemic, so just nobody was gonna come anyways. So I didn't have to be like, okay, I just need some time. And that was a nice piece that I've heard from other parents, that they felt they couldn't say no to somebody coming over. But that's basically my story. My child is now 10 months old and walking and getting into everything. And yeah, so thank you for inviting me to this. I'm really excited to be here.
Thank you so much, Andie. Queer voices like your own, they have a place in the conversation of pregnancy and the birthing process. So I'm very glad that you joined us today and sharing yours. Next up to speak is Anna. She is a queer Filipina full spectrum birth worker dedicated to reproductive justice and inclusive, radical, and affirming care. Welcome, Anna. I will give you the floor to speak on your experience.
Thank you so much. Thank you for Medical Herstory for having me here. My name is Anna Balagtas. My pronouns are she and her, and currently settled in the unceded territory of the Anishinaabe, Haudenosaunee, Wyandot, and the Mississaugas of the New Territory, most commonly known as Toronto, Canada. So I'm a queer Filipina full spectrum birth worker, and my practice is rooted in queer reproductive justice and radical care. I mostly focus on the care for BIPOC folks and the decolonization of birth work, as well as the decolonization of self, prioritizing BIPOC folks. So prior to the pandemic, I was still trying to get my certification coming into birth work, and because of the pandemic, trying to get clients was really difficult. And on top of that, birth workers are not able to come into spaces where birthing people are birthing, even if it's a home birth. Either you have a very small number of folks who can be in your home because you want to be as responsible as possible. And so I'm seeing this huge shift for birth workers to come into virtual worlds, which can be really great because that means we can come and celebrate other birth workers who aren't necessarily local to us, but is everywhere else around the world. And that's amazing. Making connections is amazing. But virtual doesn't always mean inclusive. You know, there are some birth workers who can't be on the internet. There are some birth workers who choose not to be on the internet. And that's something that's always in the back of my head. And as well, birth workers have a really physical job, and it doesn't always have to be physical. Of course, you can still call yourself a birth worker if you're advocating, you're educating, you're learning, all in yourself and through others as well. But there is a physical aspect to becoming a birth worker and being a birth worker. And so trying to switch your care virtually and still trying to make your clients feel inclusive, nurturing, like warm, and having safe care can lead to burnout. it's really difficult to try and be vulnerable with folks in virtual spaces sometimes, because there are nuances in physical worlds where touch can be so important. And sometimes all they need is touch. Sometimes they just need a listening ear. And when you're faced with a monitor or a screen, that can be really hard to translate, right? And so I've been moving my practice, not so much prioritizing physical aspects of being a birth work, but how you can be a decolonized birth worker per se. So I want to create conversations, and I want to challenge folks as to what it means to be a birth worker during a pandemic. Because when we think of birth working, I need it to be intersectional. I need it to be inclusive. We need it to be inclusive. And that means we have to think about what does it mean for underserved folks who don't have access to the internet and don't have access to care, especially during COVID. What about folks who are incarcerated? Already they're isolated, already they're lonely, and now on top of that, they won't have doulas to come and advocate with them and for them in these spaces where it can be really harmful. What about folks who are houseless? Who's advocating for them? And they are one of the most targeted groups within the pandemic because they don't have facilities and access to care. And so when we think of virtual spaces, it's not always inclusive. And as much as we can try and make it to be, it won't always be. And so that's something I want us to be mindful about. However, the brighter side of that is when you do have the privilege to being in these virtual waters and navigating digital waters, it's amazing to create such a big sense of community worldwide. I've made partnerships, I've made connections, I've made friendships of folks who aren't even in Canada. And that blows my mind. That's not something I would have thought of having had the pandemic not happened. I'm sure it would have happened, but not to the degree that it is now. So there is a light at the end of the tunnel, but there's also lots of things that haven't been addressed. Because when I think of pregnancy and when I think of COVID, I immediately think of hospitals, but who has access to hospitals? Not everyone. And so that's where I'm coming from. I'm mostly here wanting to challenge these thoughts of who is taken care of during COVID while they're pregnant, who can have access to these systems of care, and what can we do about it? And yes, that is me. Thank you so much for having me here.
Oh my goodness, thank you so much, Anna. Seeing passionate and diverse healthcare providers such as yourself really builds such profound hope into me of what healthcare can and should be in the future. So thank you for sharing your story. The next speaker up will be Loghan Wright. Loghan Wright is a former opera singer, active living enthusiast, and mom on a mission to normalize the realities of postpartum life. So welcome, Loghan, and please share your story. We're glad to have you.
Hi, thank you so very much for having me. So I am a first-time mom to my little one, Olive here. I was just over halfway through my pregnancy when everything shut down here I'm in Pittsburgh, Pennsylvania. And I was maybe just over 22 weeks. And it was just a lot of uncertainty, like there had been mentioned. You know, we went from like, we're having a baby shower to we're maybe having a baby shower to we're not having a baby shower to can we do a virtual baby shower? So then we had 2 virtual baby showers, which was wild. But it was very I just felt like I missed out on a pregnancy. You know, I wasn't really showing until the 3rd trimester anyway. And like where people could actually tell, and no one really got to see it. So I was just kind of like, here I am. My birth experience was really wonderful. I was able to have my doula and my husband present at the hospital, which was very important. We were not sure if the doula was going to be able to be there for, it kind of was going back and forth. They were allowed, they weren't allowed, they were blah, blah, blah. She was able to be there. And I had a great experience. Postpartum was terrible, for lack of a better term. I really struggled. Sorry. I feel like I missed out on like the first few months of her life because I was in such a terrible mental space. My husband was very supportive, and he more or less forced me to get the care that I needed. Breastfeeding, like there were lots of parts that kind of went into this. You know, breastfeeding really did not go well for us, and that was very difficult for me. I was thankfully able to get some support, but nothing helped in terms of that. But it was just a very dark space for me. And I think part of it was I didn't have a lot of help. I think part of it was also that leading up to pregnancy, or sorry, leading up to birth, no one was telling me about what comes afterward. No one talked. They say, you know, people kind of joke about, oh, you're never going to sleep again. Like sleep now. Ha ha. And it's all this kind of funny joke. But the reality is it's not funny. And you're going through sleep deprivation, and you're trying to feed your baby, and you're trying to figure out this new human and figure out this new identity. And there's so much jumbled space up here. And it just was, I was a mess. I had a lot of suicidal thoughts. I, you know, felt as though, you know, she would be better off with a different mom, that everyone would be better off without me. I spent Thanksgiving Day hiding in my car for 8 hours. And I am thankfully feeling like I'm on the other side of that now. I got put on meds, and I did outpatient therapy, which was all virtual, which was okay. And I feel like I'm getting to know her now, and I'm getting to know myself again. And I don't know if it was just a perfect storm. I was kind of flagged throughout pregnancy for potential mood disorders afterward, after birth. And so I don't know if it was just a perfect storm of, you know, not having a lot of support, and my predisposition and COVID and the isolation. It was just, it was really hard. And so I am very passionate now about reaching out to other moms and, you know, our other parents, pregnant people. Like, they need support, and they need to know that it can be scary and it's okay. And I want to hold space for those people, because that space was held for me. So yeah, that's it. That's pretty much my story. And thank you for allowing me to be here and talk about that.
Oh my goodness. Thank you, Loghan, for your courage and vulnerability in sharing your story. Medical Herstory and Students for Global Health, we model and celebrate work like yours in normalizing our bodies and health. And so to have you here today is such an honor. Thank you once again. Next up is Nina Huynh. She is an American-Canadian mother, lifestyle influencer, content creator, model, podcast host, and I'm sure the list goes on, but I will give it up to her to continue that list. Thank you so much, Nina. The floor is all yours.
Hello. So I gave birth in April 2020, last year, and I'm in Vancouver, and we went into kind of like lockdown, full-on quarantine around like beginning of March. So I was in my 3rd trimester. We had just gotten back from our baby moon. So I'm like actually very glad that we were able to do that. It was pretty crazy, like traveling in my 3rd trimester, but we got back and then it was like everybody stay inside. And that really threw off, I guess, pretty much all of our plans for what I thought my 3rd trimester would look like, because I work from home. I have my own schedule. And so I kind of am used to working 24/7, but I was like, in March, all of April, I'm just going to relax. I'm going to go swimming. I'm going to eat good, like just take care of myself, preparing for this baby. And then the pandemic hit and I couldn't go swimming. I like was like not going outside unless we had to go get groceries. So, you know, like when you're pregnant, you want to exercise or like walk around, and that was pretty hard to do. So it was really hard to take care of myself in the midst of everything, especially physically. And so when it came time to actually give birth, our birth plan, even before the pandemic, was to have a home birth. We felt like it was the right choice for us. We were really excited about it, just in kind of weighing the personal pros and cons here in Vancouver. We were like, this is great, let's do it. And we lived really close to a hospital. We lived really close to St. Paul's. So we were like, if anything happens, we can just go to St. Paul's. And so I went into labor a week early, or like a week before my due date. So it was still within the like a good window. And I went into labor, I felt the contractions, and we were like setting up, or my partner was setting up the pool that I could like sit in, and it was going to be great. I was like very excited. I don't think that I had as many of the fears as I think is usually expected. I was just very, very excited. And I didn't actually go into active labor at any point. I just kind of had contractions for a full 24 hours, and it was so unbelievably painful because it's just nonstop. I mean, if you've had contractions, it's not like you go to sleep and you're deep in your sleep and it goes away. It's literally throughout the night, like every 5 minutes, I was just in like pain. And it was like, you know, it fluctuates because I wasn't in active labor. So it was like 5 minutes, 8 minutes. And I was in contact with our doula. I'm very, very grateful that we had her, because we had midwives, and they were like, you know, when you get into active labor, like let us know like when you start, but when you get into active labor, that's when we'll kind of step into the picture. But our doula was with us the whole entire time. And we are very grateful that she was comfortable, and we were comfortable with having her come into our birthing space. And so she was very, very helpful in like what Anna was talking about, like that physical aspect of having somebody be there. My partner had no idea what he should really do, and I didn't really know what I wanted him to do, but having her honestly do the same thing that my partner was doing, but then me being able to yell at my partner and not yell at this like really kind woman that was trying to help me, it was just really nice. And like having having somebody else there after being in isolation and in quarantine for so long, like that physical aspect felt so normal and so reaffirming, I think, for like such a unconventional pregnancy and delivery experience. And so so essentially I went into, I was in labor, and that was the full first day. And we knew that we wanted to have this home birth, but I wasn't dilating. I wasn't really progressing. It wasn't becoming active and like set increments. It was still quite random. And so then the next day I went to the hospital, and they said that I was 2 to 3 centimeters dilated. So I still had quite a ways to go, but I had been in labor for about a day already. So they were like, you can either get admitted now, and we can give you an epidural. We can give you an epidural. We can kind of get you going. Or if you still want to do your home birth, then we can give you morphine to kind of speed up the process, and you can relax. And then hopefully that will help you get going at home. And even though I was in so much pain, I was like, I do want to do this home birth. So let's just do the morphine. Let's see what happens. And the morphine made me so nauseous that for the full 12 hours, I couldn't eat or drink anything. I was throwing up everything. So I was like at home kind of with morphine thinking I was going to be relaxed, and I wasn't. It was awful. And so that night, so now this has been 48 hours since I started labor. That night we decided to finally go to the hospital and get checked in, and my birth plan went out the window, and I wasn't going to be giving birth at home. But I got checked into the hospital, and there were so many other women, just birthing people in the hospital that day. And so I was waiting in a room downstairs for 4 hours in excruciating pain because there was just no space upstairs. And I'm sure because of COVID, there was just not a lot of space in general. So it took a really long time for me to get any meds, which I really felt like I needed because it had been so long that I was so tired. I had nothing in my system. And after 4 hours of waiting in the hospital, they brought me up to my room. I got an epidural, and then my water broke and everything started to go. My labor was really painful because I had a lot of back pain, like a lot of back labor. And even though I kind of told like my midwives, I told the doctors and the nurses that were there, nobody really seemed to take it as seriously as I think I wanted them to. Like my doula did. And she was the one that said like, your baby might be posterior, like he might be turned the wrong way. And she was the only person that said that or showed any concern, which in the moment I didn't really make note of. But eventually I was like, this is really, really painful, but I'm gonna try and push. So I was fully dilated. I pushed for about an hour or two, and then finally somebody was like, oh, I think he's turned the wrong way. So if you're like, essentially his skull, the back of his head was to my spine. So it was just bone on bone. And it was going to be really difficult for him to come out that way. And his heart rate was dropping because I think like it was like he was pushing on the cord. And so eventually I have to have an emergency C-section, which like from planning a home birth to an emergency C-section is very drastic. It's very different. And I think in the moment, I just been in labor for so long by now, this is day 3. So like, I was just like, I don't care. Like, I don't care what you need to do. Like, just, deliver my baby essentially. And so I didn't really feel fear. I know my partner started crying because he's very scared of surgery and he was so scared for me. But I was just so like, this is what I need to do. This is what we need to do. So make it happen. And the recovery for that C-section has been very, very, very difficult. I didn't at all plan to have a C-section. I knew it was a possibility. So, but everyone was saying, you're young, you're healthy, like we don't see any complications. So I just never thought about it. And it's real surgery. Like they full on cut you open, and it's almost as if you're expected to heal and jump back into mothering the same way anybody else would. And that was really hard because I couldn't do anything. I could barely go to the bathroom by myself. Like I had a catheter in for a while. it was really hard and it was really traumatic once I actually took the time to step back and look at what happened. And I struggled a lot with postpartum, as most people do. And for me, it manifested in kind of a different way, so I didn't really notice it. I was very agitated. I was so angry all the time. And I didn't think that that was a sign of postpartum. I just figured I have so many responsibilities. And so therefore, this is just the way that I feel now. This is the new me, which was really sad. I think like trying to come into your own identity and understanding who you are now as a person, taking care of this tiny human, trying to heal yourself. I was like, I've just changed as a person and I don't like this version of myself. And I didn't realize until I started talking to other people that all of that aggression and that anger, and like that sadness that I couldn't really pinpoint, like that was all postpartum. And so being able to talk to other people really did help, but it still is, I mean, it's still a process. I don't think that like after you go through such a big life-changing experience that you kind of just, that it takes the same amount of time as it did to grow a human. Like my body hurts everywhere. I can't do anything physical without feeling winded. Everything feels tight. And I think that there weren't a whole lot of resources in terms of like telling me what I should do to get better physically and mentally afterwards. Everything is about the health of your baby, which is important. But it's kind of just, yay, you gave birth and off you go. So that was my experience.
Nina, thank you for sharing. You truly are a force and such a wonderful example to your many followers and the audience joining today. So we are very thankful for having you. And I will note that Medical Herstory is dedicated to believing and recognizing pain in all people. And I'm so glad that you are able to share yours today. Our next speaker is Shala Bakhtiari. Shala is a senior midwife with Rosie Maternity Hospital with over 31 years of experience as a healthcare provider, educator, and advocate. So welcome, Shala. I am very excited to hear about your extensive experiences both before and during the pandemic.
Yes, thank you very much. Can you hear me all right? Yes.
Yes.
Okay. So first of all, I just wanted to say a huge big thank you to newly moms like Loghan, Nina, and also the experience that Anna shared with us. It was really, really eye-opening. And to me, as a midwife with these years of experience, still we have got lots of work to do for our women. It looks like we don't prepare our women. What do they expect? What is happening during your pregnancy, what's happening in labor, and when you give birth to your beautiful baby, what happens afterward. And that's why sometimes, as Loghan and Nina shared for us, it looks like a big, huge shock for them. And I think we have got a lot to do as a healthcare professionals. Obviously midwives, I am a midwife, so it is very interesting to know that before this event, I was in an international symposium, and then there is a huge big campaign happening at the moment internationally to prepare our women, especially young women, young girls that they get pregnant, to educate them during the pregnancy, the expectation that they are facing. As Caroline showed you the data with the COVID especially, you could see when our women, they have more support, especially when they are giving birth during labor, they have got more satisfactory, and their stories is better before and after. So at the moment we are facing very unprecedented situation with the COVID. It doesn't make us to reduce the care that we're providing for our women. And when I'm hearing, this is not the first time I'm hearing, Nina said, She was in labor, she was in pain, and nobody was, paying attention to her like her doula was doing that. It's not the first time I'm hearing that, and we are trying to make it round and make a big, huge change. And in the UK, we have got maternity transformation at the moment. We have got, I don't know if you know, we have got community midwives providing care antenatally and postnatally, and hospital midwife providing care when women coming into the hospital and giving birth to their baby. But we are going to change it. The change already happened. So we have got the teams of the midwives. They are looking after a group of women. They choose geographically, demographically. We have got different teams look after the group of women from the beginning of their journey till postnatal, during pregnancy, antenatal care, when they are coming for a scan, when they are coming at home, giving birth at home or giving birth in the hospital. They coming and provide care for the woman, and also postnatally, they will provide care at home for them. But we just started, at Cambridge University Hospital, we need to have 16 different teams. We just launched 3rd team, so long way to go, but we hear our women's voices. We change our way of the practice. But with the pandemic that we are facing, there are lots of changes and lots of limitation for us as a midwife. So yes, Caroline showed when, during the pandemic, when women come in for a scan, we asked them, their partner, to stay outside the hospital, because we have got a couple of scans during their pregnancy. Just a specific scans, they can come with their partner to provide support for them. Otherwise, when they're coming inside the hospital, they are on their own. And when they go to labor and starting, giving birth, we ask the partner to come and join them. And after that, as Caroline said, before we were asking the partner to leave the hospital in 2 hours, but now we change it to 6 hours, and we are hoping to get back to some sort of normality, because the COVID situation is getting better here, and I'm sure everywhere else is getting better as well. But in terms of the experience and a story of the midwife, we really suffer to see the women, they are on their own antenatally and postnatally in postnatal ward. We try our best to provide support for them, holding their hands, listening to them, helping them with the breastfeeding. But the harder we try, because of the resources, we have got limited number of the midwives in each shift, in each area of the hospital, but there are some limitation, and this limitation make us to not be able to provide the fantastic care that we want to provide for them. But we try our best. The first lady that we thought she may have COVID in our unit, I looked after her, and then she ended up going to theatre, and I was with her. And because we didn't know she's having COVID, she's positive, she's negative, we didn't know the status of the results, and we had to cover ourselves. We call it PPE, personal protection equipment. I don't know, you may have seen it anywhere in the television, in the report. It's really scary for the woman. And even when we were talking, when we are having full PPE, the voices is not as clear for them. So what I did in theater for her, I sat next to her and I hold her hand. And at that time, she managed to have her partner with her there. But I'm just thinking it was it was February last year, but I never ever forget that situation. And then after that, we had all our women providing care with those, personal protection. And it is very difficult for the midwives as well. Imagine we are having 12-hour shift with this protection, and then we had to change our layout of our wards. It was very difficult to do that. changing the layout of the rooms. They were asking us to maintain 2 meters distance with the woman. It was an absolutely impossible for us to do. When you are looking after a woman, you want to provide care for them, you want to be compassionate with them, you want to hold their hand. We are midwife, that's why we are midwife. We wanted to provide the best care for them, touching their body, touching their abdomen, and then it wasn't possible at all. So that's why we had to cover ourselves, full cover most of the time, and it is very, very difficult situation to provide care for our women. So and I just wanted to say to Andie, we had a situation, we had somebody like you in our ward during pandemic. So it is very I can relate what he was saying, and the story was really, really brave that he shared with us. It was really, really fascinating. And I just wanted to say this to newly moms and the one that they are pregnant or planning to have a family, that midwives, especially midwives and all health worker professionals, especially in pandemic, we're trying to do our best to provide compassionate care for you and listen to you, and as much as possible. But pandemic just make us to have lots of limitation, is because we are responsibility to provide the safety of you and your baby and also our staff. So this situation, I've been midwife for so many years, but this situation, it just make me to think about the whole mental health that we are facing regarding the providing care for women, and also the mental health level of the mental health in our within our professionals, within a frontliner, is really, really damaging at the moment. And as I said, I cannot wait to see one day that we're coming and we're not covering our face, we're not using the face mask when we say hello to our women. And yes.
Thank you.
Yeah, we do. Yes. Okay, so I just wanted to say I really, it just breaks my heart when listening to all of your stories here, and just wanted to make sure we are in your side. And please, when you need to talk to somebody, just ask for help. When you are I don't know, you are from different countries, I don't know the first point of care for you when you are pregnant, who is, but whoever is, please communicate with them, please ask for help. And I always working in individual birth choices clinic, so women coming when they, for example, when they had previous cesarean section, they want to have home birth, they're coming and we talk all of the risks, we go through everything with them. But it is very interesting with the pandemic, most of the women, they're asking about when they can have their partner, when they can go home, when they are in the hospital, how is the situation? Would they be only the one in the room? Would anybody will answer their calls? It is very, very interesting that, most of the hours that I spend with the woman, I need to answer lots of questions about the visiting time, which is really, really concerning for them as well.
Thank you so much, Shala. Between you and Rosie Maternity Voices from earlier, your mothers and birthing folks are in such compassionate and caring hands. So I thank you for your work and for joining us today. Our final speaker. Thank you. Our final speaker for our storytelling segment is Emma Chapman. With unexplained bleeding and premature contractions in her first pregnancy and a pandemic in her second, Emma offers a very unique story. So welcome, Emma, and please feel free to share your experiences.
I think you might be able to hear me now, hopefully.
We can, thank you.
Thank you very much. Yeah, I feel so. I've given birth twice at the Rosie Hospital, so it's been really interesting to hear what Caroline and Shala have just had to say. With my first daughter, Lyra, she was born in 2017, and I feel like with her, I've seen every single ward on the Rosie. So I had unexplained bleeding first of all, and then when I was 25 weeks pregnant with her, I had contractions, and they did something called a Partashore test, which came back positive, and doctors were saying different things about the percentage chance of whether or not I would go into labour in the next week. So I spent a week in hospital then, which was really worrying. Luckily, she held on for a few more weeks, and she was born at 36 weeks, but then was quite poorly and was in NICU for a few days. And then we were on a transition ward after that for another, I think 5 or 8 days. I can't quite remember, but yeah, but that was all good. And the care whilst I was in labour with her was really good. She got stuck, and that was very similar to Nina, and she ended up being an emergency C-section as well because she was back to back. But I felt that the postnatal care when I had Lyra wasn't as good as it was during COVID, which kind of surprised me. So Alice was born in April of last year, at the kind of height of the first wave in the UK, when everything about COVID was really unknown. Nobody really knew what was going on. People were panic buying in the shops. I remember we were trying to get hold of nappies before she was born, and it was really, really hard. And we were like, oh no, what are we going to do? And we tried to get some formula milk as a backup in case breastfeeding didn't work out. And that was really hard because people were panic buying that. And so it was a tricky time. And we were kind of staying at home as much as possible. At the time I'm a primary school teacher, and I think the Prime Minister announced that pregnant women were now on the at-risk list. And so my head teacher called me one day and she said, right, we won't see you tomorrow. So that was it. So I didn't get to say goodbye to the children, which was really hard. But luckily things were fine. None of us caught COVID, which was really good because that was my main concern. And then when I went into labour with Alice, I called the hospital and they said, come in. And it was dark. I think it was about 5 o'clock in the morning when we arrived. And my husband had to stay in the car. And I remember a security guard let me in. And I felt really, I felt quite strong in myself. I was like, right, I can do this. I walked into the dark hospital, having been let in by the security guard. And I thought, nope, I'm going to walk up the stairs. I'm going to be strong. So I walked up the stairs. And the midwife who met me at the door, she was really kind, and she assessed me. And then she was like, oh, you're about 3.5 centimetres, but it's a really good 3.5 centimetres, but you need to be 4 for them to allow your husband in, but it's a really good one. So I'm going to talk to the, she said, we're going to talk to the, I'm going to talk to the main midwife and like fight your case, and he'll be allowed in. And fortunately he was, which was really good. And then I had Alice, and she was born pretty easily compared to Lyra. And then I spent one day on the postnatal ward, and it was really quiet. There were only 6 other people on there. Partners weren't allowed at all, but in a way it was quite nice. I feel like the few women that were there, we bonded, and there was a nice sense of camaraderie. And I feel quite lucky in that respect, compared to some people's stories that I've heard that have had children during the pandemic. So yeah, so I feel very lucky. So yeah, thank you for letting me share my story.
Thank you so much, Emma, for both your strength and courage in sharing your story. And I will extend a thank you once again to all the speakers for your vulnerability and letting us hear your experiences today. So with the storytelling segment complete, we will now be moving into our open panel discussion. For this section, please feel free to comment, discuss, or ask questions about each other's experiences. But I will introduce one formal question just to kind of guide the discussion for the next little bit. And this is in regards to the limitations many of you noted in your stories. So formally, in light of your experiences, what are some challenges which new and expectant parents face in being pregnant during the pandemic, and recognizing these challenges, what are some improvements you would like to see to pregnancy and birthing services, both during the rest of COVID-19, hopefully it ends soon, and moving past COVID-19 in the time afterwards? So if anyone wants to start us off, please feel free to unmute.
I'll start. This is Andie. Specifically for, COVID related things, I know that I was really lucky to have my partner there. And there were a lot of people who weren't able to do that. And I think now that there are some restrictions being lifted, a lot of pregnant people are able to have that. But for me, I think I wasn't ready to go home at like 18 hours after birth. I could barely walk. And they're like, here's this very, very tiny child that you now have to take care of. And that was something that I was not ready to just like go home. I was not. That first night was really, really tough for us because we didn't know what we were doing. We were terrified. Is his chest moving? I don't know. So I didn't get much sleep, and then all of that. So that's something that I, hope for the future, is that postpartum period in the hospital, if somebody chooses to birth in a hospital, is lengthened. And not COVID related. I know that, for me being a trans man, there was a lot of barriers in like insurance. My insurance, I legally changed my name and gender several years ago, at the same time when I had top surgery, and my insurance didn't understand how to code it correctly in order for me to get that prenatal care, because in their systems it was very binary. Prenatal equals women, and since you're coded as a male, it made a big mess in my insurance, and I kept getting these bills for like $10,000, and I was like, I have very good insurance, this shouldn't be happening. And every time I talked to somebody on the phone, they didn't get it, and there was somehow no way around it. And the insurance piece was something that I never thought of. I knew that there would be a very gendered world, and that there would be a lot of like people who would say, oh, congrats, mama, or whatever. I knew that going into it, but I didn't expect to have to deal with it on a policy level as well. And so that's just something that really was an additional issue, and on top of a pandemic, and being pregnant and trying to keep everything like under control.
Thank you for sharing. Yeah, both of those challenges I recognize obviously affect mothers and birthing folks during the pandemic as well as moving forward. So any other speakers want to comment on challenges and improvements?
I can't speak. I guess, I only really know my experience like through most of my pregnancy was through COVID, right? So I don't know what it would have been like outside of COVID. I don't know how different it would have been. Like I mentioned, my birthing experience was great, and I didn't really want a lot of people in the hospital, and she was born at night. Like at 8 p.m. and we ended up spending, she was like slightly jaundiced, and so we ended up spending like 2 nights in the hospital. And by the time we were being discharged, we were like ready to go. I think outside of COVID, just postpartum care, I will say, I think we actually need to listen to parents. That I don't feel heard by medical professionals a lot of the time. I do not think that the postpartum screening that is required at pediatricians' visits are all encompassing. You know, was that Nina who mentioned that she was having like basically experiences with postpartum rage, which nobody talks about. They just screen you for depression, and the only like those things are you having suicidal thoughts? Do you want to hurt your baby? Like, and when there's so much more that goes into it than these little bullet points. And you know, when I'm sitting there crying, saying like, my baby screams when I try to feed her, what's wrong? And they say, oh, I'm not really sure, everything looks fine, because it happened to be a good feed when I went into the LC that day. Like, that's not helpful either. So I just think listen to parents. And I think for any medical professionals, I'm sure that there are a lot of, maybe I just have the wrong medical professionals, but a lot of times, I especially as a first-time parent, I think we kind of like they're like, oh, you're just worried. Like, you're just a first-time parent, you don't know. And, but that's not okay. Like, we need to be heard, and I need to feel heard. And I often don't.
Thank you so much. Yeah, the birth experience doesn't end at birth. There is the time right after which mothers and birthing folks really do need support, and I am so glad that you are doing the work in normalizing those realities. Any other comments on this question, challenges and improvements to the birthing process?
Yeah, I think there's a lot of emphasis on birthing parents as patients or as clients of the hospitals or of the medical system. But I also want to give a highlight to birthing partners, especially when they're the only advocate who's available in the room. And this is for people who have birthing partners. Of course, there are different family dynamics. Maybe you're a single parent, maybe you're a poly parent. Whatever kind of parent you are, your support is your most important village. And because of the pandemic, there's the rule, only one person with you in the room, if you're lucky. There are some places where that's not even available. But I just wanted to mention that birthing partners also need to be as equipped as birthing parents. So a birth worker's role actually is to help birthing partners help the birthing parent. Like, we show them how to do comfort measures, how to repeat the affirmations, and just be the present person for the birthing parent. But now we see that more so, because if birth workers aren't allowed in the room, then it's all on the birth partner. And that's such an incredibly difficult job to carry, especially if you're not nuanced in the world of birth working, you know, and you're seeing your partner feel so scared and feel in such pain. That's difficult for you. And when it comes to people supporting the birthing partner too, within the hospitals or within your home births or anywhere else, check in on them too. They're just as important as your patients. They come as a family unit. Take care of them as well. That's my biggest one. And out of COVID, you just need to be more equipped of different families coming in, because I think there is that binary of cis hetero folks coming into the hospitals having babies, but it's not always, you know, a cis man and a cis woman having a nuclear family. As I mentioned, poly parents exist. A person can have different types of families coming in, and these systems of care, like healthcare, should be well aware of that. You should know that there are different families that exist. And sometimes there are parents who want to birth alone, and that is absolutely their right, and you need to know how to take care of them as well. So that's my hot take.
Anna, those are amazing comments. And on the point of postnatal care, both Medical Herstory and Students for Global Health have created a resource repository, which will be made available to everybody who signed up for the event. And so if anyone joining us today is a birthing person in the postnatal period or in the pregnancy period who needs extra support, please follow up with our resources. I wanted to move on just to our little next question, which is about advice. As a catalyst and moving forward, what is one line of advice that you would provide to people going through the experiences that you just went through? So we can kind of go around the table and ask one person at a time. Emma Mathers, you are my first. And so what's one line of advice that you can provide?
I would say, can I give two?
Of course.
I would say that it's always just a phase and it will get easier. And I would also say, don't compare yourself to other people and don't compare your baby to other people. I read somewhere, I'm not going to claim this quote as my own, but comparison is the thief of joy. And I strongly agree with that.
Amazing. Jumping to Loghan Wright, if you could provide yours.
I would say trust yourself and you don't have to listen to all the noise that's coming at you. There are a lot of opinions, a lot of to do it, and you will find the way that works for you if you trust inside and listen here and not here.
Truly, you know best for your own care. For Andie Hosch, if you could provide yours.
I would say especially for any, transgender people who are thinking of starting a family, my biggest advice is if it's something you want to do it, because it was one of the best experiences I ever had. Regardless of all the stuff that happened in addition, I look at the little child that I was able to make, literally made a child. And I just feel so much joy, and I just want everybody who wants to experience that to be able to experience that.
Perfect. On Logan's point, you know best for your own gender transition and nobody else can dictate that for you. So thank you. For Anna, if you would like to provide yours.
For sure. A big reminder that you are deserving of the most incredible, the most radical, and the most beautiful care that you can possibly imagine for yourself. And if you are under any sort of suspicion that you are not getting what you deserve in terms of beautiful care, challenge it. That is your absolute right to challenge these systems, to challenge these institutions, to challenge yourself, because you deserve all the best things. That's my biggest advice.
Oh my goodness, I love that so much. Nina Huynh, if you're still with us, if you could provide yours.
So I would say to, I guess kind of riffing on everyone else's, but to prioritize yourself. I know that that's very hard because you just brought this like beautiful little human being into this world and it's all about them, and everybody in your world is going to prioritize them. But in order for you to be the best version of yourself for them, you need to focus on healing yourself and making sure that you're okay mentally, physically. And it's something that I really prioritized like immediately after giving birth. And I'm really glad that I did. I went to a lot of acupuncture, massage, things that felt frivolous, that didn't feel necessary because the healthcare system doesn't, cover those things, at least here. But in doing so, like, it allowed me to be much more present with my baby. And I'm really grateful that I did that in the beginning.
Thank you for sharing that profound thought. It's the notion of fill your cup first. Make sure you are being taken care of before you can provide it to another. And finally, Shala Bakhtiari, if you want to finish us off.
Yes, I would say, you know, you should know it's okay to be scared and it's okay to feel lonely, because the situation you may not be, you never had experience, but don't be silent and make your voice heard and make communications.
Thank you so much to you, Shala, and everyone for joining us today. That is the end of our panel discussion. Thank you so much for sharing your experiences. I will now kind of give the floor to Lucy as part of Students for Global Health to direct any questions that we received from the audience. And so Lucy, take it away. Thank you, everybody.
Yeah, thank you everyone. It's been really interesting. It's been a really great evening. Yes, I'm Lucy. I'm from Cambridge, member of Students for Global Health. So we've got a couple of questions coming in from the audience. The first one is, how has the COVID pandemic impacted your way of keeping in touch with your family and friends? And how are you and your baby doing now? So I don't know if Emma, you want to start?
Yeah, we like things like FaceTime and online chatting with family and friends has increased and started. It was my Nana's 85th birthday today, and so my auntie was around there today, so we were able to FaceTime with my Nana so she could see her great granddaughters, which is something would never have happened before. And the girls are really fine. Lyra has kind of settled into pandemic life, and she's really happy. She goes to preschool, and Alice knows nothing different. I'm going back to work in 2 weeks, and she's going to a childminder on Monday just for an hour. I'm actually really worried about leaving her more than I was with Lyra, but I think that's because she doesn't know that other houses exist, that other people really exist. So I'm just going to have to kind of hope for the best and hope she's okay. But apart from that, we're all doing really well. So thank you to whoever asked that.
Good stuff. Logan, do you want to take the floor?
Yeah, I mean, it was hard, like not being in touch with family. I will say we were fortunate. My husband's family did come in and stayed for like a couple of weeks. Everyone had different comfort levels, but we don't have any family here. But they did come in and help us out. But you know, it's been difficult, like having people not meet the baby and like not having a lot of help, and but we figured it out, you know, and you know, we FaceTime people and everyone's trying to make the best out of a crappy situation, right? Like, so that's what we did, and you know, we're just making it work, and it's like one day at a time, and it's getting better, and you know, there's light at the end of the tunnel right now. So
cool. And Andie?
Thankfully we were lucky. My partner's parents live really quite close, and so right after that first night that we were home, we went up there for a couple of weeks, which was really helpful. But I was looking at, we were thankfully able to, we had a baby shower shortly before everything shut down, and the memory on Facebook popped up with all these people who came to this baby shower. And I think maybe 3 of the people who were at the baby shower have met the baby. And that's something that was unexpected. Where it's been a little bit rocky just between like financial stuff with hours being cut at work and things like that. And thankfully we're doing all right now, where it's feeling a lot more smoothed out. You know, my hormones I think have finally normalized, and my baby is doing awesome. I think I mentioned it earlier, he started walking, which is crazy, but we're doing well.
Good to hear. And Nina?
So my baby's doing great. He is almost 11 months now. He's very happy. I feel like because I mean, we work from home, so it kind of honestly would be the same. I feel like if there was a pandemic or if there wasn't, but being able to spend every single day with him, watching him grow up has been so, so beautiful. And I feel like, I don't know, I think he's like a very exceptionally happy baby. And I feel like a lot of that is because we get to spend so much time with him. So I'm really grateful. And I forgot the first part of this question. I was thinking about it and then I forgot.
That's all right. Just how's the COVID pandemic impacted the way you keep in touch with your family and friends, and how are you doing now?
So yeah, I was thinking about this really hard because I am from San Francisco, so my parents haven't been able to meet him, which is it's been really, really hard. I usually go back to see them like twice a year before the pandemic, and I think just to have this tiny human that you love so, so much, that is such a big part of your life, and not being able to share those with the other really important people with your life is hard. And I know that's not a unique experience to me, but I've cried many, many nights because I haven't been able, or like they haven't been able to meet their first grandchild, and that sucks. But they've met him over FaceTime.
Cool. We've got one more question. I'll just throw this out to anyone that wants to answer. So someone in the audience has asked, what can I do as part of a family member support system to help them if they're currently experiencing anxiety during their pregnancy, or are going through this pregnancy alone without a partner? If anyone wants to answer that.
I can answer. If I understand the question correctly, I think that's something that would have really helped me before my pregnancy and afterwards, is just like so much food, because afterwards, like after you're giving birth and if you're trying to, like, even if you're breastfeeding or not, like everything is about this baby. And so when you do have a moment to yourself, the last thing you want to do is like figure out what you want to eat. And then because of the pandemic, it was really hard to grocery shop. So just order so much food, because that's like one thing that you just won't have to think about. I think that would have been really helpful for both me and my partner, because both of us were like running on E for a long time.
I would say
Totally
if you can
want to second that. Oh, sorry, go ahead, Logan.
Oh, I was going to say, if you can be there physically, just do things around the house for them, like, you know, and don't ask, don't say, what can I do for you? Because then that puts the pressure on them to make yet another decision in their day, which is exhausting. So just say, I'm going to do these dishes. Why don't you shower? Why don't you take 30 minutes to yourself? Literally just offer, and tell them, like, you can say no. Like, if you don't want this, if this is not helpful to you, but I'm offering it. Just literally silver platter. Like, that would be the most helpful thing. And just don't ask, because when people will ask me, like, do you want me to come over? Do you want me to do this? I'd be like, you're already like frozen inside. If you're like anxious or depressed or whatever, you're already like at this space where you can't respond. And it's too exhausting to think of what you actually need.
Can I add something, please?
Yeah, go for it.
Yeah, so I hope, you know, in terms of the mental health and depression during pregnancy, I hope they are starting to seek help before they go into the dark side of it. So I'm just saying, in my personal experience, it doesn't matter if you're pregnant or you are not, but because myself, I had to self-isolate the first lockdown in the UK, 3 months. And then I decided, because it would damage my mental health. So what I did, I said to myself, I have to do something about that, because I couldn't even go outside the house. My friends, they were coming, and then they were standing in the middle of the road, and then waving their hands, and then we had a little conversation behind the windows. And I decided to do something about that. So I was having regular exercises in the morning. And then I made this online chat with my family back in Iran. I am in the UK, I'm originally from Iran, so I'm sure you have noticed from my accent. And we were having yoga every day with my family. And then I did it for 4 months constantly. And then I think this helped me. But because my daughter was here with me and the school was closed and she was 12, and then we had online Zoom birthday party, she really enjoyed that. But it affected her mental health as well. So the whole family, it was affected. And we have got chats for the shielding people, friends and colleagues and family members. And I think, during pregnancy, I hope they do something before it goes to the very, very difficult circumstances. Just being in contact with their family and friends. I know it's not the same. It's really, really difficult. But this is me, especially I have lost 2 of my family members to COVID, so it didn't help as well. But having conversation, having group chat all together, it really, really helped. Especially when I lost them immediately, having just chat that we are having now, it really, really helped me.
Yeah, sorry to hear that, Shala. And thanks for the advice. Right, thanks for the audience's participation. That's great. I'm going to hand back to Tori to wrap up. But again, thank you for speaking, everyone that's got involved.
Awesome. Yes, thank you again so much to our speakers for their vulnerability and realness. I think we see often announcements on the news and we don't get to hear from the people that are actually directly impacted. So thank you again. And thank you everyone who's stuck through the whole panel and Q&A. I really appreciate it. So I do have just a quick wrap-up slide here to encourage you all to check out Medical Herstory to follow us for more content like this. We'll also be posting some great event recaps, so stay tuned for those. And you can find Students for Global Health handles there as well. And I'll also plug some of our further events if you enjoyed today. So if you'd like to share your story through writing, video, or audio, we are accepting submissions anytime. And if you submit before March 31st, you have a chance to win $100. Nice thing to treat yourself. We also have an amazing Our Bodies, Our Voices, Our Stories coming up. That's going to be held throughout March. That's going to be a really nice healing journey. And then we're going to be having a panel on Indigenous women's health later this year that you can all stay tuned for. So thank you again so much, everyone. We really appreciate it and hope you have a great rest of your day.